Thank you for inviting me, and thank you to the organizing committee in Thailand, HAI, for inviting me to this session, and thank you for the introduction. So my topics relates to joy at work for staff well-being and better patients' outcome. This topic is about improving staff well-being to improve patients' outcome, and I will have a half an hour presentation for you all to describe to you what Sing Health, which is a cluster of healthcare institution in Singapore, is doing about staff well-being. So as you know, the Global Patient Safety Action Plans focus on number 5 on health workers' education, skills, and safety. And in it, there is the aspect about safe working environment for health workers. So a couple of things. What is burnout? Burnout is an occupational phenomenon that results from chronic workplace stress. And there is a feeling of energy depletion, increased mental distance from one's job, and reduced professional efficacy. The other aspects relating to cyber is incivility, and incivility can range from rude or unsociable speech or behavior. And it actually is not good if someone is rude to us because it reduces our ability to do our jobs properly. They're actually actively making us worse with the rudeness. And the impact of it is quite bad because it increases in diagnostic and procedural errors, and also reduce the performance of doctors if medical teams are to perform in the presence of rudeness. So again, here there are a couple of aspects relating to incivility. You lose time over rudeness, and a lot of them will leave the organization, 12%, and 38% will be reduced in the quality of their work. So it can spread to the rest of the team very fast if you have rudeness in your environment. We actually would like to measure, I think it's important in the healthcare right nowadays to measure what is burnout and what is incivility. So this is the standardized skill measurements from the Mass Large Burnout Inventory to look at emotional exhaustion, depersonalization, and lack of personal accomplishments. These are the 3 categories of burnout. In terms of incivility, there are 3 categories as well: workplace related bullying, person-related bullying, and physically intimidating bullying. So we did a survey in Sing Health. That was 2019, before the COVID. And to our disappointment, there's actually quite a fair bit of burnout. 37.8% had emotional exhaustion, 29.7% has depersonalization, and 55.3% has low personal accomplishment. So if we talk about burnout, usually we talk about the EE and the DP score, and that amounts to a combination of 43.9%. So 43.9% of our staff in Sing Health are burned out, right? I think there's something we need to look at to be able to reduce this burnout. Again, we did another survey in 2023 after COVID, right? And again, it shows that there is emotional exhaustion and depersonalization, but it was sort of reduced a little bit. The personal accomplishment, there's lack of it, actually increased. And we also measure the empathy. The empathy for us wasn't that great as well, according to this score here. And in terms of the negative, in terms of the exposure to negative act, we have quite a fair bit as well. These are the percentages. And we went on to compare with a UK, one of the institutions, and we found that our bullying, actually, our incivility is actually higher for medical, nursing, and allied health, and maybe lower for the non-clinical staff. So we do have incivility in Sing Health as well, and we need to be able to take actions. Because poor well-being is related to poor patient safety. And many studies have shown that there is a significant association between burnout and poor patient safety and poor well-being and worse patient safety, right? So healthcare institutions need to provide a safe and a healthy place for patient safety. So we now look at how can we improve this environment, this what they call nowadays the joy at work, the joyful workplace culture, the support and resilience culture, and trying to reduce the apathy or the burnout culture within our system. It's very important in patient safety to tackle the culture, not just the systems, and not just looking at resources, but to look at the culture. So what is it that we need to do or need to do in SingHealth? Well, in order to address burnout, instability, and well-being, we need to have comprehensive and dynamic actions to address burnout. Because the care, compared to the past, is getting more complex. The expectation from staff and patients are higher. Stress is increasing, and the change are getting faster all the time. There are three aspects I'd like to go into because it is not a one-size-fits-all. You really need to take into a number of consideration. Firstly, there are different components domain to work on, and you need to prioritize in view of the limited resources. Secondly, you need to look at different population segments. Different folks require different strokes because they have different psychological capital. And we need to tackle it at all levels, from the junior to the seniors, all healthcare groups and disciplines, and for difficult situations and issues. So I'll just go through a couple of them now. As mentioned, in fact, in yesterday, my talk relating to the Global Patient Safety Action Plan, the most important component is actually leadership. It's the leadership commitment towards patient safety. It's the leadership commitment towards tackling burnout and incivility. That is actually the main so-called component that you need to look at, because that will influence how we will look at culture, system, and the resources. The leaders need to engender a good culture, make a great system, and look at resources and make use of resources effectively. So in SingHealth, starting at the point of COVID, just the early days of COVID, we decided that this is an important thing for us to look at it, and we call our task force the Joy at Work Task Force. And this is actually led by the top person in SingHealth, which is the group CEO. And at that point in time, we have a strategic meeting. We decided that we should form the SingHealth Group Office of Staff Wellness. So we have a group director of staff wellness, and we have a SingHealth Wellness Council, which will look into all the issues relating to staff well-being. And later on, of course, we organize conference, and we even make use of many apps to help us. So this is one of the conference they call the SingHealth Way of Wellness, called the WOW conference, which you had recently to discuss about the issues. And we even launched a so-called a logo, Staff Wellness, people at the heart of all we do. In SingHealth, our tagline is patients at the heart of all we do. But for that group office relating wellness is people at the heart of all we do. And there are 5 components here in terms of physical health, mental wellness, workplace wellness, culture and values, and community and engagement. We are looking at the 5 C's that the group office will look into on behalf of SingHealth. At the same time, all the institutions, they will have a wellness office, also a wellness officer, and they attempt to create a joy at work environment for staff. So this is an example of my hospital, KK Women's Children's Hospital, the total wellness framework that was launched again at that time. I think it's quite comprehensive. They look at various domains in terms of the mental wellness, physical safety, psychological safety, and look at all the factors that contributing towards that: leadership, continuous improvement, healthy working environment, undergirded by all the things listed here: senior management, appreciation, and recognition. So their task is to be a joyful, healthy, careful healthcare community leading in total wellness. And I remember during the launch, I gave a talk that's relating to staff well-being and patient safety, an important healthcare paradigm. First, I look at the different components of domains to work on. These are the 9 components domains that we adapted from the IHI. So physical and psychological safety, choice and autonomy, appreciation and recognition, feedback, learning and improvement, participation and communication, teamwork and camaraderie, and wellness and resilience. So there are many areas to look at in order to achieve that. Of course, is require a multi-pronged approach, and of course, it needs prioritization, as I mentioned just now. So in fact, we created at the cluster level, the IPSU created various programs to address the various aspects of here. I won't go into detail, just to say that, for example, for psychological safety, we actually create a program called Team Speak. For teamwork, we lean on team steps, which I think many of us becomes trainers for that, to train a group of people who would carry on the workshop relating to team steps. So these are the areas that we look. It's a multi-domain aspect. And here is the sort of the full list that we have launched over the years to address the joyful workplace environment, to promote that. And these are leadership support. They are customized, contextualized program with local scenarios tailored for the individuals and team to select. So this is an example of email that was sent to all SingHealth staff to encourage them to come for the program and the workshop. Team Care, Team Joy, iThrive is a mindfulness session for iThrive here. Yeah, fostering joy at work for patient safety. Now I go on to the second aspect that's relating to different population segments. There's a need actually to look at it in a different way, because we can apply the same strategy for the whole population of our staff. Because different staff have different psychological capital, because some of them may have very high psychological capital, some of them have very low psychological capital. So their ability to manage stress, to manage the work environment are different. So here, for example, you can see here A, B, C. A are those with very high psychological capital, B are the normals, and C are those with very low psychological capital. So basically for the A, we will engage in different way. In fact, they can become workplace wellness champions. We engage them to be that. Because they can be able to run programs for us, to be able to encourage their peers along. B, we will apply, to encourage them. We will try ways to improve their psychological capital so that they can better have cope with their environment, to have good resilience and better support. And C, of course, is the area that we will need to pay more attention to, where we will provide all the emotional support, the care support that is needed to help our staff to move along, because they have less resilience, because maybe they do have circumstances that we can help them. Sometimes they may be in their home, there may be issues, or sometimes they may have mental issues, and that we require a lot of support. So basically, as we are talking, staff are not the same, they are different. So this is the psychological capital we are talking about here, measuring them in terms of efficacy, optimism, hope, resilience, and how they are able to do that. And if you have good psychological capital, then you look at how, in terms of emotion and psychological activities they have, to look at their behavior, and in the end, in terms of citizenship and culture. Those with high psychological capital will, the end, you will have very good staff engagement, and they will become good corporate citizens or healthcare staff. So how can us leverage on this to do that? So these are some of the things that we can do to enhance psychological capital. We have workshops for positive psychological tools. We have mindfulness. We have care support. We have incentive and recognitions for, for behaviors, and we have engagement programs so that they become good citizens. We do have a SingHealth Staff Care Center. There's a one-stop center to provide for SingHealth staff psychological support needs, especially those I mentioned in Group C, where they need that probably the most. And we are trying to enable cluster-wide access to this staff peer support and counseling services. So here is, for example, just today, in our toilet, right? So actually, the toilet or the restroom is a place of refuge. Sometimes staff, get very emotional upset. Sometimes they just go to the restroom to relax. And as you can see, in all the toilet rooms doors, right? If you close the door, you can see this. Whether you need emotional support, and there is phone lines that you can call to get help in terms of the support for your emotions itself.